So compression fracture is a term that's given to a type of bony injury that occurs usually within the spine. Thoracic spine is the most common area. Thoracic spine being the 12 vertebrae in the mid part of the back. Can occur in cervical and lumbar, but typically thoracic. Now these type of fractures, whilst the terms fracture aren't the same as if someone says you've got a broken spine, you wouldn't really term a compression fracture as a broken spine. What it typically means is the vertebral body, so the body that sits at the front here, and if I just grab this little one here to demonstrate a bit more clearly. You've got the vertebral body at the front, the discs sandwiched between. A compression fracture is where you have damage to this area here and it compresses, it drops down a bit. Nearly always seen in people with osteoporosis or osteopenia. Now, osteoporosis and osteopenia is just a lower level, so it's not quite a level of osteoporosis. Osteoporosis is a grading scale towards the density or the quality of the bone strength. Typically, osteoporosis, osteopenia is seen typically in women, typically post-menopausal, usually over the age of 60, 65 plus, and it can cause this weakening of the bone, not just the spine, but the whole skeletal system. Weight-bearing exercise is critical to try and improve or reduce the impact of osteoporosis, osteopenia, as is some medications, and people often be given bone scans, density scans, to see what the bone density is like. X-rays are very poor in identifying osteoporosis, osteopenia, or even bone density at all, so it needs to be a slightly different type of scan. Vitamin D, calcium, etc. supplements are a good idea to try and help prevent. Weight-bearing exercise is critical. So if someone develops one of these compression fractures, and they're extremely common, extremely common, they can be very sore, sometimes they're asymptomatic, there are no symptoms at all. It will mean that the vertebral height will reduce slightly. Sometimes people actually overall in height will reduce over a period of time. This is particularly true in osteoporotic patients, whether it's male or female. And that can be very sore. They're generally self-limiting, which means they will sort themselves out, they don't need any intervention. In certain cases, there's a surgical intervention called vertebroplasty, where they can look at doing a particular procedure in certain cases if they're quite extreme and if they're caught quite early, although that's not that common. But as I say, typically thoracic spine, reduction in vertebral height, can be very sore, generally self-limiting. If you do suspect you've got mid-thoracic pain, it's worth seeing GP anyway, because that's not a great symptom to be getting, and there's a variety of different causes for that. But osteoporotic compression fractures are very common, and it's probably a very likely cause of that pain, that mid-back, in that certain age group, 60, 65 plus, particularly women. It's something to bear in mind.